There are many symptoms involved in a TMJ dysfunction, which is one of the things that's made proper diagnosis of a TMJ problem now difficult and confusing for practitioners. Symptoms of TMJ dysfunction might involve chronic headache or migraine, pain anywhere in the face, head, or neck, stiff neck, low back pain, grinding or clenching of the teeth are also a sure sign of a TMJ disorder. Popping or clicking or pain as you open and close your mouth, pain in your jaw muscles as you chew and even when at rest. Ear symptoms such as ear pain, stuffiness or itching, loss of hearing, dizziness or tinnitus. Eye symptoms such as pain in or behind the eyes or blurring of vision, pain in a tooth or sensitivity of your teeth. All of these are symptoms of TMJ dysfunction.